Drug addiction is defined as taking the psychoactive drugs in the wrong amounts or in the large amounts that can be hazardous or harmful to that particular person. So it can be quite hazardous on that particular person's body who is a drug addict. And we have basically gone through the different effects that it can have on the body of that person. What are the different manifestations of the different groups of drugs on the drug addict? And then there is the withdrawal syndromes or the withdrawal symptoms seen whenever that particular drug that the person is addicted to is withdrawn or the person stops taking that drug. There are particular symptoms that the person goes through, and those are basically regarded as the withdrawal symptoms that we're going to discuss over here in this section. So the substance misuse and the violent behavior. So whenever the person is a drug addict to whichever group he is addicted to, it can be to any ecstasy group or any category A drugs, or it can be the category B drugs as well as the category C drugs that are usually prescribed even over the counter. The person still can develop that violent behavior. Basically, it's a demoralizing behavior that he's developing through that drug addiction, and that is quite harmful to the society as well. So the impact on the individual is quite significant over here, and we'll be discussing that over here, what impacts he's going to have. His family is going to be affected, his friends are going to be affected as well as the whole community is affected when a single person gets addicted to a particular kind of a drug. Then the chronicity of use is again very important, and the routes of administration of these drugs that are commonly used for misuse or commonly used for addiction are again important. There are a lot of drugs that are used in their injectable forms, and they have their own hazardous effects that we'll be discussing over here in this section. So in high doses, there is a disinhibiting effect that we usually see. There is an impulsivity, aggression, or abusiveness that is commonly seen when a person is misusing a particular kind of drug. So basically, the behavior of the person is linked to the substance misuse again over here. There is agitation seen, and then there are delusions of grandiosity seen. Even delusions of paranoia are seen in a lot of individuals as well. The person becomes suspicious as well. There are psychotic episodes, and the person may develop that bipolar affective or the mood disorder, in which the person goes in states of depression as well as in states of mania as well. So the chronic misuse is also is taken into account over here. We can see the dependence syndrome in a lot of individuals. The unpleasant symptomatology is observed. Then there is a state of confusion that is experienced by that particular individual. There are cravings for particular food. There is anxiety. And then the person may also go through those depressive episodes whenever he is chronically using any drug. The intoxication is seen in these individuals. There is impaired attention and paranoia observed in these individuals as well. And then the delusions and hallucinations are seen. The psychosis and comorbid use is also seen in these individuals. Non-adherence to medications or even violent behavior is seen in these individuals. Now, whenever we talk about delusions or whenever we talk about the hallucinations, delusions can be of the delusions of the grandiosity, or it can be the delusions of paranoia, or the delusions of prosecution. Then hallucinations can have tactile, auditory, or visual hallucinations as well. So the social isolation is observed in a lot of cases. The degree of impairment depends upon the amount of drug misuse that the person is subjected to. The intoxication involves the road accidents, and a lot of severe injuries occur due to these intoxications. Alcohol intoxication is one of the commonest intoxication. The consequences can relate to the degree of dependence, the quantity and the quality of substance that is used by that particular person. And then the routes of administration. It can be inhalational route, it can be an oral route, or it can be injectables as well, IV, or it can be the intramuscular or the intravenous injections can be used by that particular person. The physical problems like pain and infection, they start in that individual. Then the lack of coordination or ataxia is seen in these individuals. Then disinhibition or slurred speech. So that is basically due to the fact that a particular lobe of the brain is affected whenever we talk about the slurred speech. There is coma and death, and hypoglycemia and hypothermia is also seen in these individuals. Now, the medical emergencies, there is alcohol withdrawal, the unpleasant sense, tremulousness, and nausea and vomiting is also experienced by these individuals, sweating and delirium tremens, general malaise and insomnia. Benzodiazepine withdrawal is one of the criteria over here, in which it is present in a similar fashion. When there is withdrawal from opiates or it is from any kind of stimulants, opiates basically belongs to this stimulant group. It's not that risky, and there are general aches and pains, diarrhea and vomiting, runny nose or eyes, difficulty in sleeping, and the part of the withdrawal state. When there is a withdrawal from the stimulant group, there is an inertia. Basically, the person stops and he resists that withdrawal symptoms, but still he develops them after a while. The person can go into depression, increased appetite, retardation is usually observed in these individuals. Usually the person's thinking process is retarded in this criteria. Then there is suicidal ideas. The person may have those delusions of grandiosity or even those delusions of prosecution. The depressive episodes can be so severe that the person can develop suicidal intentions as well. The chronicity, basically the cardiovascular or the respiratory disorders are affected first of all. It's basically giving you an idea of the chronicity and the effects on that person, the systems which are affected. The cancer of lungs, lips and tongue, etc. The cancer of liver and bowel is seen. Fertility may be reduced in these individuals. And then we can have heart diseases or strokes. So here you can see the pattern that basically the cardiovascular system as well as the respiratory system is affected whenever we are talking about the chronicity of the use. Injecting the drugs basically involves the risk of infections, obviously. And the basic infections are the HIV, Hep B, C are transmitted through these routes. The contamination from blood or the bloody fluids is again very important, and whenever we are injecting drugs, these hazardous effects, they can affect the community on the whole. So the septicemia, localized infections, deep vein thrombosis, thrombophlebitis, abscess formations, these are the other hazardous effects that the person can go through whenever he's injecting that particular kind of drug into his body. So in this section, basically, we focused on the different withdrawal symptoms that the person can go through whenever he stops taking that particular drug of addiction. So that is the end of this section. Thank you for watching sqadia.com.